And welcome back to Everyday Iowa. Dr. Ben Wyant from InMotion Pain Solutions joins me, and today we're going to discuss stenosis. Welcome.
Thank you. Good morning.
Good morning. So tell us, what is stenosis?
Stenosis is a fancy word that means a hole is getting smaller. So when we talk about stenosis, so far as my office, we're talking about spinal stenosis. So we're talking about the canals where the nerves pass out of the spine and feed out into the body.
Okay.
So stenosis is a degenerative condition where the spine is collapsing due to arthritis, wear and tear, and these nerves are getting caught as they exit out of these holes.
Okay. And what are some of the symptoms of stenosis?
Pain is the big kicker.
Pain, yeah.
But difficulty with weight bearing. So the majority of these patients, they really have a hard time with standing and walking. If they can sit, if they can lay, that is their position of relief.
Okay.
Oftentimes they'll have pain that radiates into the buttocks, down to the legs, all the way to the foot. They'll have altered sensation, pins and needles, numbness, things like that.
Okay.
Weakness and not a lot of stamina. You know, those are the big kickers. But one of the dead giveaways of stenosis, if they can get a little bit of a supported lean, they do much better. So these are the folks who need the shopping cart to be able to get around the grocery store.
Oh, sure.
Or if they're going somewhere that they're not familiar with, they almost have to, in their mind, plan out, where's the next place I can sit?
Wow.
Because they can only go so far.
So their quality of life is really
Majorly
deteriorating.
impacted.
Okay.
Absolutely.
So how is stenosis treated outside of your clinic?
One of the most common approaches that we see with stenosis is physical therapy coupled with injections, usually trying to get a little bit more mobility into that joint space and cut down some of the inflammation that's present, be able to relieve the symptoms.
Okay.
We'll also see a lot of the patients who have had a surgery, usually something along the lines of a fusion, where they're using screws and rods, hardware to stabilize the spine and provide a little bit extra support.
And are these treatments, are they effective?
They can be.
Okay.
Most of the patients that we visit with have failed their courses of care.
Okay.
We're kind of looking for those basket cases and oddballs.
Right.
So what ends up happening, a lot of times these approaches do help to relieve the symptoms for the patients, but they're not addressing the driving cause of the arthritis itself.
Okay.
So their relief will be a temporary measure.
Okay.
The patient will respond to care, but as time goes on, especially things like injections, it's diminishing returns.
Right.
Every time they have an injection, it lasts a little less time, and eventually it doesn't have any effectiveness for them.
So it's a Band-Aid, essentially?
It can be.
Okay.
It can be.
Okay, so how do you treat stenosis in your clinic?
We have two objectives when we're working with stenosis. We've got to restore proper motion. So we're going after the arthritis itself. We're going after those joints that compromise. We've got to get the pressure off the back, and we've got to get those nerves some breathing room. And our second objective, we've got to heal these damaged tissue. So the cartilage of the discs, the nerves themselves, tendons, ligaments, muscle, any portions of the joint, and that allows us to have a sustained relief of pain for these patients.
So that's why that's the best approach, because it's sustained?
Yes, we have to be able to address all of the factors, not just one or the other.
Right, okay. That all kind of ties in too with the name of your clinic, InMotion Pain Solutions.
Absolutely. That saying goes, a body in motion stays in motion, and the other half of that, if you don't use it, you lose it. So if we can get these joints moving, it allows us to protect the health of the joint, the integrity of the joint, and keep these people viable, give them that quality of life over the rest of the time that they have.
Okay, and now you have no cost, no obligation consultations and second opinions. Tell us about that.
We always start with a no-cost consultation, and that's the opportunity for that patient and I to have some conversation. As I want to understand what's going on, the first thing I got to figure out is if I'm the right guy. Are our approaches going to be successful for them? Because if not, I got to be able to share that.
Right.
What we do next is we enter information gathering stage. So if a person has imaging, I want them to bring it, X-ray, MRI, because I'm going to look at it with them.
Sure.
That way we can explain and they understand what's happening. If they don't have it, we can shoot X-ray in the office. We do examination. I keep it affordable, $50.
Oh, wow.
We go to our report phase next, and I generate a report and I give them 4 bullet points. If it's stenosis, what's the extent? If it's another condition, what's going on?
Right.
Number 2, how do we treat it? So what does care consist of? How many appointments? What's the timeline we're working over? What is the improvement I feel I can deliver? What is the long term? How do we sustain that? What is the cost associated with care? And what is insurance going to cover?
Okay. And where can people find you?
We're at 1967 51st Street Northeast. We're over near Tyson's and Cedar Rapids. Otherwise, they can call us at the office at 319-200-1495.
Okay.
And we also have our website, InMotionPainSolutions.com, all one word.
Okay. Thank you so much for being here. So yeah, you don't have to live in pain, everyone. That's
Give us a call.
Yeah, give him a call. You don't have to live with pain. Thank you so much. I appreciate it.
Thank you, Chris.
Thank you. We do have to live with the weather, though, so let's check in with Hannah Messier.